everyone, my name is Anna Joya, and I'm going to be explaining the topic of Medicaid, and more specifically, how Medicaid has affected elders and children, along with the expansion that has been implemented in some states across the United States. First and foremost, we'll define what Medicaid is, and Medicaid extends health coverage to numerous individuals in the United States. Some groups who are included in this eligibility are low-income adults, children, pregnant women, elderly adults, and individuals with disabilities. This program is administered by the states adhering to federal guidelines, and it is financially supported by a collaboration between the state and federal government. So they have to work hand in hand, and then a lot of states have their own rules and regulations, but again, the overarching kind of governance is federal. So the first article that I looked into was modeling financial eligibility for Medicaid, long-term services and supports. So here I take a look at who is eligible for Medicaid, and that really comes down to low-income families, children and pregnant women more specifically, and then who has difficulty becoming eligible for Medicaid would be adults under 65 with no children who are minors. So when you take a look at Medicaid and its impact of people behind the poverty line, it is important to know what poverty is defined by and who exactly falls under that line. So in this case, poverty is characterized by insufficient resources necessary to achieve a minimally acceptable standards of living that fulfills the basic needs. And through research, I found that the basic needs include health insurance. So poverty measures should encourage the expansion of Medicaid to help the impoverished fulfill their basic need of, being healthy and secure. One example that I found helpful was just taking a look at Georgia's Medicaid representation. Again, why I chose children and elderly to kind of focus on is their presence in the Medicaid system. So as you can see, predominantly assist children and elderly individuals, 25% being elderly and 67% being children. So Medicaid effects on children in the welfare system. I chose to look at on this angle because I think it's very interesting to think about healthcare within a system that is so unreliable, I would say, whether it's children in foster care, moving from house to house, city to city. I think having a steady healthcare system can be very daunting and scary for young kids to understand. So in low-income populations, children and adolescents involved in the child welfare system are the most vulnerable to health and mental health concerns. So in the child welfare system, Medicaid has been a critical link to children and adolescents' health and mental health services. However, when in the system, receiving Medicaid, more specifically informal care, can be difficult when moving from place to place. So this is a chart that was taken from that academic article, and it kind of shows the Medicaid coverage of youth involved in the child welfare services. And this is interesting to look at the different types of eligibility, the difference in out-of-home and in-home. And then overall, the in-home coverage was as low as 66% for children involved in child welfare services. You can also see the amount of children that could be eligible for Medicaid was a little over 2 million individuals. So when looking at elderly and Medicaid, you can kind of think about this through a different lens that brings a lot of different state and local regulations and opinions. Elderly individuals with limited income may qualify for Medicaid if they fall into one of the four groups. Individuals receiving cash benefits from the Federal Supplemental Security Income Program, those with substantial medical or long-term care expenses in relation to their income, individuals with income below the federal poverty threshold, and those with incomes between 100 and 120% of the federal poverty threshold. Now, one of the overarching themes that I chose to focus on was the expansion of Medicaid. This expansion has only been started in a few states, some of which including Virginia, Maine, Utah, Idaho, Nebraska, Oklahoma, Missouri, and South Dakota. The Medicaid expansion gave states the chance to provide Medicaid coverage for just a lot more groups of people and just help the federal policy level. The federal policy level is $13,590 for individuals and $27,750 for a family of 4. Now, as I mentioned previously, the Medicaid will cover pregnant women, elderly individuals, children, and individuals with disabilities, but there are a lot of other groups who are not going to be covered by Medicaid. With the expansion, there is a little bit more flexibility in who will be covered by Medicaid. These include adults who don't have children, and then people who in the past have earned too much money to qualify for Medicaid, but now in the present they are below that wage. So now we can take a look at the Code of Ethics. I think that through my research, a lot of the Code of Ethics were matched in a positive manner due to putting one's healthcare first, more specifically with Medicaid, especially with the expansion in some states. I think they're putting dignity and worth of a person first, ensuring health insurance and basic needs. I think they're applying service to others above self-interest, helping people afford healthcare who couldn't without it, and social justice, who should be eligible for Medicaid, which is a question that still is present today. And then finally, my discussion question is, what are the critical ways in which Medicaid impacts both elderly individuals and children in terms of their access to healthcare and social well-being? And that is all. Thank you so much.